antidepressants don't address the root causes of depression, at least probably. Like, they're really just a tool in the toolbox that can help with the symptoms. But for a medication to be effective, it doesn't have to address the root causes of an illness. Like, if you go get strep throat, you'll probably take Tylenol and Motrin and maybe even aspirin to help with the symptoms of pain and fever while you're sick. And you may even go get some antibiotics from your doctor. In fact, you should go get some antibiotics if you have strep throat. It'll help you heal faster, and it's safer because there can be some nasty things that pop up from strep throat, like rheumatic fever. But even then, like, the antibiotics might help your body fight off the infection, but we could argue that those antibiotics aren't addressing the root cause of your illness, because maybe your illness is you have poor hygiene. Or maybe your illness is you work in a place with poor public health. Or maybe the issue is you work around a lot of sick people. Like, the root cause of any illness is far more complex than looking for a medication or some sort of intervention that will address that root cause. And antidepressants are no different. Like, an antidepressant is not going to be able to change years of abuse, neglect, or years of unhealthy thought patterns, or poor self-esteem, or poor coping skills with life. They're not going to be able to change an environment that's difficult to navigate. But antidepressants can help you feel better so that you can begin to more effectively look at and navigate what's going on in your life. They can help to alleviate some of the deep suffering that's associated with depression. They can help to alleviate some of the hopelessness and some of the pain that patients with depression feel. And those patients with those symptoms of depression, like, feel it at a deep level. Like, there's research studies that demonstrate the pain that we feel emotionally in depression is felt by the same centers of the brain that feel physical pain. Like, that pain of depression is real. And so just like we would go treat physical pain and we would help alleviate the suffering of someone who's suffering physically, it also makes sense that we leverage every tool in our toolbox to help with the pain of depression, even if that intervention may not be addressing what we might perceive as the root cause. Antidepressants may open up some windows and may give us some more tolerance in life to be able to more effectively engage in things like psychotherapy or with our families and communities. They may help us be able to better engage relationally so that we can actually begin to address some of the root causes of things that may have led us to that depression in the first place. And so, yeah, antidepressants probably don't fix the root cause of depression, but that doesn't mean we shouldn't use them. It means that they may still be an effective tool in the toolbox when we're truly suffering.